Started in 2018 with the unveiling of Vanderbilt's new transgender clinic, and they were motivated to get into the gender transition game in large part because of all the money there is to be made from it.
Starting in January 1st of 2017, according to the Affordable Care Act, insurance carriers are mandated to cover medical expenses for trans folks. Some of our VUMC financial folks in October of 2016, started a couple of years ago, put down some costs of how much money we think each patient would bring in, and this is only including top surgery. This isn't including any bottom surgery, and it's a lot of money. These surgeries make a lot of money. So female to male chest reconstruction can bring in $40,000. A patient just on routine hormone treatment, who I'm only seeing a few times a year, can bring in several $1,000s. That requires a lot of visits and labs. It actually makes money for the hospital. Now, these I got from the internet, but it's from the Philadelphia Center for Transgender Surgery, which does a lot of surgery for patients. And I just want to give you an idea of how much these bottom surgeries are making. And I think this has to be an underestimate. This is for a vaginoplasty. They're quoting roughly around $20,000 for a vaginoplasty, but that doesn't include your hospital stay. That doesn't include your post-op visits. That doesn't include your anesthesia, your OR. So I would think that this has to be a gross underestimate. I think that's just like the surgeon's piece of it, which anybody who's ever been in the hospital knows that that's like 10% of it. And then the female to male bottom surgeries, these are huge money makers. Again, I think this has to be an underestimate that they're quoting around $20,000 for a phalloplasty. There's been different things that I've read that said it could be up to $100,000. Dr. Winokur, who's our surgeon, says that there's entire clinics where the entire clinic is supported just by their phalloplasties, and that is like a fraction of the surgeries that they're doing. These surgeries are labor intensive, they require a lot of follow-ups, they require a lot of OR time, and they make money. They make money for the hospital.
Yes, if you get one of these surgeries, you will be doomed to a life of continued hospital visits as doctors work to keep your fake sex organs nominally functional. It'll be miserable for you. I mean, you have signed on to be a patient forever. But it's great for the doctors at Vanderbilt. I mean, they love it.